Well, the treatment for pulmonary fibrosis is quite varied. It does depend on the type of pulmonary fibrosis that a person has. So if a person has what is called idiopathic pulmonary fibrosis, this means that there is absolutely no reason known why a person develops a pulmonary fibrosis type of disease. If that occurs, we have two drugs on the market. One is called nintedanib, and the other is called pirfenidone. Their easier names are Ofev, which is nintedanib, and pirfenidone is Esbriet. So these are drugs that are meant just for idiopathic pulmonary fibrosis, but no other type of pulmonary fibrosis. If the pulmonary fibrosis is due to a sort of an allergic response to an outside antigen or protein or molecule, then the first step, of course, is to remove the individual from that exposure or get rid of the exposure. It may sound easy to do, but often it is detective work to even find out what's causing the pulmonary fibrosis and the response in the lungs, and then to find measures to get rid of that particular substance. So it's not that easy. And if that is the case, most of us start with removing the inciting agent, and if we can't do that or find the reason why the person has the pulmonary fibrosis and the individual is quite ill with the pulmonary fibrosis, then we will start something called prednisone. This is an immunosuppressive agent that is used for the short term. So if the disorder continues to get worse, then we substitute the prednisone with a little bit better, less side effects with mycophenolate. That's one option. So these are really the only two big agents that we use for that particular type of pulmonary fibrosis. If the pulmonary fibrosis is from what we call an autoimmune disorder, and some examples of autoimmune disorders are like rheumatoid arthritis, scleroderma, lupus, then again, depending on how bad the situation is, we start out with prednisone, and then we substitute either mycophenolate or azathioprine so that we don't have the individual with lots of side effects that prednisone gives. Then if the fibrosis is from something that was an occupational exposure, the exposure is gone, then we assume that the changes will not progress and there is no real treatment. Other types of treatment are with supportive measures such as oxygen, making sure the person has good oxygenation at all times, and we try to target 88% and higher in saturation, make sure that the individual is fit and well conditioned, weight being at the ideal body weight as best as the person can imagine, make sure that your vaccinations are up to date, and then people don't have just pulmonary fibrosis, they have other disorders as well, like hypertension or heart disease. So it's important to treat those as well. And again, recognizing that pulmonary fibrosis has very minimal treatment available. And if we want to improve the quality of life and prolong life, then the physician who is looking after a person with pulmonary fibrosis also has to be responsible or take charge of managing those other problems as well, usually in conjunction with another specialist, such as a cardiologist if it's heart disease, or endocrinologist if it's bad diabetes.